Now, I used to have a slide in here about costs, and that there's an increased cost in health literacy. And I took it out for a couple of different reasons. And it's because there's no doubt that hospitalizations cost money, and that there's an opportunity for cost savings if we can do a better job and folks don't end up at the hospital as often. But the interesting thing is that people who have low literacy are less likely, at least some of the time, to get preventive services. They're less likely to go to the doctor. And so in some ways, it may actually balance out in the cost. What's the cheapest health care? No health care, right? So we have to be really careful when we talk about costs. So I took that slide out. So to shift gears a little bit, low literacy is often overlooked. As you saw in the video, people are embarrassed about it. They're ashamed. They don't talk about it. If you ask people how well they read, they tend to overestimate their ability. And so some people think they can read better than they can and don't really realize how it impacts their ability to effectively learn and understand things. And then in healthcare, there's always an issue of trust. If the patient doesn't trust the person they're talking to, they're less likely to believe what they're told, and they're less likely to communicate effectively. They tend to shut down, and they tend not to do the things that they need to do to get better or stay healthy. But folks with low literacy, from my work with the adult educators, Wisconsin Literacy and those folks, they're especially reluctant to give their trust to somebody. And so it's even more of an issue with folks that can't read very well or don't understand English very well to develop their trust to have an effective relationship with them. These numbers are a group of low literate adults were asked who they had and had not told about their difficulty with reading. The numbers that you see here are the percentages of these adults who had not told their children, for example. 52% of them had not told their children about their difficulty reading. 62% had not told their friends. 68% had not told their spouse. Isn't that interesting? They're more likely to tell their children than they are to tell their spouse that they have difficulty reading. 75% had not told healthcare workers, and 85% had not told their coworkers. There are some ways that one could guess or estimate who's more likely to have trouble with low literacy. If they're older, they have less education, if they're not white. I didn't mention immigrants before. If you come to the United States after age 12, the chances that you're going to understand English at something more than the below basic level is less than 50%. So folks who are not native English speakers tend to have a lot more trouble with this. If you're low income, you're on medical assistance or Medicaid, you get government help with your insurance, or if they've ever been in jail before. Those folks are more likely to have low literacy. But the bottom line is you can't tell by looking at somebody. Most of the people at the below basic level don't fit the stereotype. 75% are born in the United States, 50% are white, 40% hold full or part-time jobs. So as the healthcare providers, if you're not aware of this, somewhere between a third and a half of the adults that the system interacts with can't read very well. Not surprising that people are, quote, non-compliant. It's a whole other way of thinking about things. Most of the patients I see want to stay healthy or get better. There's a few who don't, but most of them do. And so think about how difficult it would be if you can't read very well to try to get a test done or go see a doctor that you've been referred to if you can't read well enough to get a driver's license. Somebody told you which bus to get on to go to work and come back from work, and you have a little card with a bunch of words on it that refers you to somebody else across town to get a test or to see a specialist. Think about how big those barriers would be.